Hello. Another video. I went to my ENT, ear, nose, and throat doctor, for you guys that don't know the acronym, and I get my ears cleaned out approximately once every 5 months or so. I tend to get this dry earwax that I've always had throughout my life. It's just like a genetic thing. I don't know if it's because, I do know why I get build up. It's because I get dry skin and that I get this really dry wax. And also, I think I have a really small ear canal, and that probably perpetuates the problem. Anyway, I'm not here to talk too much about my ears. I'm here to talk about the one thing that bothers me the most. One of the things that's the most irritating and frustrating thing when I ever go to the doctors. And even though I tell you guys and gals that I would recommend to always try to get a physical so you have a clean bill of health, despite saying that, making sure you go to your dentist at least once every 6 months, get a cleaning. Especially as you get older, you want to do your routine checks, your colonoscopies if you're a woman, especially if you have cancer running in your family, your mammograms and whatnot. I still hate going to the doctors, and one of the things that bothers me the most, and I want to hear from you guys and gals, what's the thing that bothers you the most? And I think a lot of people can relate to this, and that is having to wait, constant wait times. It's probably worse if you don't have an appointment, such as if you go to the emergency room. I don't think in recent time, I've gone to the emergency room. I did go, and you probably can't see, I got a scar right here. I think I mentioned it in a video a long time ago. I ran into the corner of a wall when I was like 3 or 4 years old. I don't really remember much, so that doesn't really count. I don't know how long I waited because they stitched me up. But anyway, I went to the ENT yesterday, and I pretty much timed it. I waited about 24 minutes just to get called in. It's not too bad, I guess. 24 minutes past my appointment time. Still a little long. It's about one TV show, right? One comedy TV show, 24 minutes. So I get put in the room. They check my blood pressure. And the good news is that my blood pressure was 119 over 82. It's been progressively just going down over the years. I used to be about 140, then I used to be 130. I haven't been 119 now. I know it can fluctuate at times, but 119 over 82 is fairly good, so I'm very proud about that. Anyway, they take my blood pressure, and after that, the lady says they'll be with you one moment. And it's like, okay. This time it was a physician's assistant, I think a PA, and I see the doctor once a year. So after that, I'm sitting there, I'm like, okay, cool, making progress. And then I wait. And then it's another about 24 minutes again. I looked at the clock, and 23 or 24 minutes. So it was like 48 minutes before I even get attended to. I mean, that's close to 50 minutes. That's kind of hitting my limit. Lady apologizes. She's very nice, and she says that they're a little bit short-staffed. A couple of the MAs called in, and I can relate to that. I don't know if you can tell, but this is not my normal attire on the weekends. These are scrubs. So people that might be new to my channel, so I work at a hospital, so I can see both sides of the spectrum, being the patient and being the worker. So I can relate, but it's still frustrating. Nonetheless, she apologized, and she cleaned out my ear, and the process itself didn't take too long. And then I was still, by the time the delay happened and I did the exam and got my ears cleaned and made my future appointment, my follow-up in about 5 more months, I was out in about an hour. So an hour, I guess, in the grand scheme of things is not too bad. There have been horror stories, like I said, if you don't have an appointment, going to the urgent care or emergency room, you could be there like 7-8 hours. It's just absolutely ridiculous. So that is my number one pet peeve. What is your number one pet peeve while going to the doctors? Is it the actual exam that scares you, or is it the wait times? I mean, I will admit I'm working on it. I'm a pretty impatient person. I like to believe that, yes, I am impatient, but I like to be efficient. And if I don't see efficiency, it just bothers me. And one thing I want to say is there's always a reason why doctor's offices are late, and I also can speak from experience working at a hospital. So I can speak from my profession, but from other professions. But in general, there's a lot of things that are out of people's control. So for instance, in my job, we are, especially right now, we're very busy and we have patients basically every 15 minutes. And if one patient shows up late, it causes a domino effect. So let's say if you start clinic at 8 o'clock in the morning and you have someone at 8 o'clock and 8:15. Well, if that first person shows up at 8:10, right before the 8:15, you get stuck in no man's land. Do you wait for the 8:15 to show up, or do you just squeeze it? You just do the 8 o'clock patient who showed up 10 minutes late? Typically, when you don't have any wiggle room, you just got to keep going on the schedule. So what happens, you end up doing the patient at 8:10 instead of 8 o'clock. It was supposed to be 15 minutes. Next thing you know, you finish by 8:25, and then by the time you get set up for the next patient, and guess what? It's 8:30. Now it's 8:30 for the 8:15 patient, and you're 15 minutes behind. You got to play catch up. You catch what I'm saying. Then you might get a very difficult patient. You may fall back even further, and it's ironic because today, not ironic. It's good timing to do this video today at work. We're behind due to a number of issues. The patient's bladder wasn't full enough. For whatever reason, the doctor wasn't happy with the image, the x-ray image, so we had to get the patient down, restart the process, put them back on the table, yada, yada, yada. So I understand how at times it can get very frustrating, but at times it is out of your control. Now, sometimes it's not always the patient's problem for being late. That is only one aspect of this dilemma. The other thing that occurs, and I've seen it happen at doctors' offices, is that they know you're handcuffed, meaning they want to, you gotta realize that it's all about making money. I don't care what anyone says. This whole world is based on money, including the medical industry. It's a multi-billion-dollar industry. The pharmacies, the pharmaceutical companies. But anyway, so I gotta say, yeah, these doctors' offices, they will often, they might get you in for an appointment, but some places they will cram in as many patients as possible, despite knowing that they're going to be behind, because they don't care, because they know if you get more patients, you get more money and you can bill it and insurance will cover. So doing that is immoral as well, because you're wasting people's time. And you know that a lot of times when people are at the doctor's office, it's not like they're going to reschedule, because if they reschedule, they're going to have to wait another few weeks. And a lot of times they're in a lot of pain, so therefore they're handcuffed and they have to stay. So all the pendulum of power is all directed. It's lopsided. It's all going towards the medical practitioners. So I just wanted to bring that up. What can you do to prevent waiting too long? I mean, the only thing you could do is just try to be a responsible patient, try to just get there on time. If everyone tries to make the best effort, put their best foot forward, and try to be on time, then it doesn't create that negative domino effect like I mentioned previously in my example, especially at my work. Yeah, but anyway, that's about it. I hate waiting. That's why I hate going to the doctors. The actual procedure, depending on what I'm doing, it doesn't bother me that much, but having to wait is so much. And last thing I want to say is that is one reason why I take great pride in trying to take my patients on time. Now, I would say roughly 90% or more, I try to take my patients within 15 minutes of their appointment time, assuming external factors are not taking effect, such as patients showing up late and just a machine breaking down. We had a power outage one time, but outside of that, within 15 minutes is very reasonable, and that's what I pride myself on doing, because I understand that people want to go on with their day. Who wants to stay at a hospital hours on end, you know? So I might not be the most, and I've had people or patients say, like, I don't smile enough, this and that, a lot of times because I'm very stressed out, and I'm trying to be as efficient as possible. Efficient, accurate, and professional, and That's what I pride myself on. That's my time. Thanks for watching. Just want to give a little bit of perspective from my side, being that I, work in the hospital, and I am a patient when I go see any doctor. That's my time. Talk to you later. Bye.